Hi everyone. So in this session, we're going to be covering the deformities of skeleton. So let's start off. There can be various reasons due to which there can be deformities in our skeleton. One can be genetic reason, one can be nutritional deficiencies, one can be because of hormonal issues. So we're going to cover all of those one by one. First one being the genetic causes. So there you have osteoarthritis. Remember that. Then you have your cleft palate. Then you have microcephaly. Let me explain all of these one by one, starting off with the easiest one, which is microcephaly. Micro means small, cephaly means this thing means head. So, this is a genetic condition in which people tend to have very small heads. Let me just show you a picture of it. Microcephaly. Okay, let me see why is this in Arabic. Yeah. Yeah, all right. So here you can see the images. This is the normal head size. It should be this much, but the head size is smaller. So here it says that it's a condition where a baby's head is much smaller than expected. During pregnancy, a baby's head grows because the baby's brain grows. Microcephaly can occur because a baby's brain has not developed properly during pregnancy or has stopped growing after birth, which results in a smaller head size. So as I've said, micro means small, and Sfel or Sfeli, it means Sfel basically means head. So you can remember it from that. So it's a genetic cause. If parents have it, very likely it is that it's going to be transferred to the offspring. Next thing is cleft palate. Now in cleft palate, all right, so cleft palate is okay. First, let me just search it up and show you the images, and we can work with that. Yep, right here. So this upper thing is called palate. You have the soft palate towards the back, and you have the hard palate towards the front. So, here in this condition, what happens basically is the palatine processes of maxilla. Maxilla is your upper jaw. So, the palatine processes of maxilla and the palatine itself, they fail to fuse. This causes an opening to be left, like there's an opening between your throat, you can say, and your nasal cavity. So this opening between oral and nasal cavity causes it interferes with your eating habits. For example, if you're eating, the food is gonna end up going into lungs, god forbid. So this can cause further issues like aspiration pneumonia and so much more. So yeah, it's a genetic disorder again, right? So here they're saying the roof of the mouth, which is the palate, is formed between the sixth and the ninth weeks of pregnancy. A cleft palate happens if the tissue that make up the roof of mouth does not join together completely or it doesn't fuse together completely during pregnancy. For some babies, both the front and the back parts of the palate are open. So that's like a severe case. So, yeah, as I've said, this can further lead up to aspiration pneumonia when the food, when you're basically inhaling the food into your lungs. So, yeah. Now, moving on to osteoarthritis. Now, there are three major types of arthritis that we're going to be covering. So, I'm gonna get to osteoarthritis in detail later, but for now, I'll just let you know that this is the most common form of arthritis, and it is called usually as a degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hands, hips, and knees. Now, what happens here is basically this is the chronic arthritis, as in it's persistent, it stays there for a long period of time, and it's just basically the wear and tear of your joints. So for now, you can know that when I'm covering the other two kinds of arthritis, I'm going to come back to this. All right. And here I use the word chronic. So I want you to know the difference between chronic and acute disorders. So acute is basically something that is just there for a short period of time. It came, now it's going to go away. For example, you're sick. for just a little period of time, and it's gonna be fine. Chronic is when something is continual, it's recurring, it's persistent, and it stays there for a longer period of time, right? So let's see. A chronic condition develops and worsens over an extended period of time, as in atherosclerosis, and in an acute condition, symptoms appear and change or worsen rapidly, as in a heart attack. So, acute pain is a sudden sensation that alerts us to possible injury. Chronic pain, pain that persists often for months or even longer. So, yeah. Acute disease, sudden onset, cure, usually it can be cured. Course is short. Patient is passive. Physician is dominant. Return to normal, likely. Yeah. So chronic disorder or chronic disease is just the opposite of this. There's a gradual onset. Um, the cure for it is quite rare, and the course is lengthy. So just the usual differences. Moving on. Now we're going to go to hormonal causes. So we're done with the genetic diseases. Genetic, as I've said, one is microcephaly, one is osteoarthritis. Remember that, and one is microcephaly, I've said, and one is cleft palate. Sorry. So cleft palate, microcephaly, and osteoarthritis. Moving on to hormonal diseases or hormonal causes for the deformities of skeleton include osteoporosis. Very important for you to know. Osteoporosis. Now, in this, what happens is basically that your bone density decreases. Fine. For example, this is a normal bone. See, it's so dense, and this is a bone with osteoporosis. There's so many pores in it. So many pores. You can see the stages. This is a healthy bone, then this is osteoporosis, then this is severe osteoporosis. So it's basically your bone is losing its density, and it's see this means that it's so fragile, it's so weak, it's so vulnerable to the fractures. Now let me just tell you what exactly happens here. So here, basically, the bone resorption outpaces bone deposit. Now, what should happen ideally is calcium should get deposit in your bones. But here, the calcium is being resorbed from the bones, like it's being removed from the bones in order to fulfill the needs of your blood. In this case, bone mass is reduced and chemical composition of the matrix remains normal. Osteoporosis mostly occurs in aged women, which is related to decreased estrogen levels. So, usually, you can say after menopause, this is very common in women because their estrogen level is low. So, osteoporosis can happen. Occur. Other factors which may contribute include insufficient exercise, so it's related to decreased estrogen level. Other factors which may contribute to osteoporosis can be insufficient exercise, poor diet, like diet which is not rich in calcium, which is not rich in protein. Then smoking can also be. I know smoking it's kind of odd, but yeah, it also links to this disease. Now, what can be cures for osteoporosis? So ERT is basically estrogen replacement therapy. It offers the best protection against osteoporotic bone fractures. So yeah, you can women especially can take ERT, which is estrogen replacement therapy, and that's gonna surely help in this. So you can see. I don't know why I find this image so oddly satisfying, and at the same time, it's so uncomfortable. I don't know if that makes sense, but I don't know. Weird. Anyways, osteoporosis develops when more bone is broken down than replaced. The inside of a bone looks something like a honeycomb. When someone has osteoporosis, the bone which forms the walls of the honeycomb gets smaller and the spaces between the bones grow larger. This is such an accurate description. The outer shell of the bone also gets thinner. So they're saying the thing that forms the walls of your honeycomb, they get thinner. So see, this is getting thinner, and the holes ultimately will get wider. Moving on, now we're done with hormonal causes. It is osteoporosis, and this is because of estrogen. So estrogen is a hormone. That's why this comes under hormonal causes. Next, we have nutritional causes. deformities due to nutritional causes. One is osteomalcia, one is rickets. Rickets and osteomalcia, they're one and the same thing. Osteomalcia is basically rickets in adults. Adults. So yeah, rickets, you can see. In severe cases, it can cause bowed legs. Also, it can cause a deformed pelvis. So this is usually due to um, deficiency of vitamin D. Now, vitamin D is important because it helps in it itself is not important. It's important because it helps in the absorption of calcium. So when there's no vitamin D, calcium won't be absorbed into the bones. So osteomalcia we can see as well. It's the same. It's just the same. Fine. Have they said anything about it? Osteomalcia, or is it Malaysia? I think it's supposed to be Malcia. Is softening of the bones. It most often occurs because of a problem with vitamin D, which helps your body absorb calcium. Your body needs calcium to maintain the strength and hardness of your bones. In children, this condition is called rickets. Right. So yeah, we've covered three various reasons why you have deformities in skeleton. One is genetic reason. So in that we covered cleft palate. Next, we had microcephaly. Then we did osteoarthritis, right? Then we have hormonal causes. For that, we covered osteoporosis. Yeah. Then we had nutritional causes. For that, we covered osteomalcia and rickets. So that's all for today.